Hi everyone, and welcome to this Planet Red Summit session on the response to the COVID-19 pandemic to learn how did our efforts in institutional preparedness paid in the response to this pandemic. So we'll have 1 hour and a half together. I would like to inform you as well that interpretation is available. You have a small interpretation logo down the window and you can click on it. Interpretation is available in French and in Arabic. So this session is meant to discuss and to learn how our efforts in emergency response preparedness were able to actually support a better response to the COVID-19 pandemic. As you know, this pandemic has caught all national societies in their daily work with a lot of expectation and a lot of responsibilities to address this pandemic, facing different types of challenges that they might or might not have been very well prepared to address. It also gave a lot of visibility to the national societies, again, at a time when they were maybe not expecting it much, and a lot of expectations also from their government in supporting them in the response to this pandemic. In addition to this, of course, other types of disasters did not stop happening. So even though at the beginning, maybe a lot of activities have been put on hold because of all the different challenges, at some point other disasters came in, and many national societies were faced with having to deal with several disasters happening at the same time, and maybe a higher level of complexity than they were used to handle in the past. So it's also an opportunity to reflect on what have we learned from this kind of real-time learning, and to what extent the efforts that were put before this pandemic in terms of developing our capacities to deal with emergency have been able to show indeed concrete results and improved response to the COVID-19 pandemic, also improved capacities to fulfill our auxiliary role of supporting the government. So during this session, we'll have a short introduction beyond those few words with a video, and I will also share with you the findings of a study that was made to also reflect on the same topic. And after this, we'll have a panel session with 4 panelists that I will soon introduce, a session which will last about 1 hour. And we will end the session with a specific focus on disaster law to also reflect to what extent our efforts in this topic, or maybe our gaps in working on those topics, have shown results or gaps in the response as well to the COVID-19 pandemic, because it appeared that it was indeed a very critical component in our ability to respond well to this pandemic. And if we have a bit of time towards the end, we'll have a Q&A session, but we're not sure if we'll have enough time. So if you have some questions, feel free to also put them in the chat. So for now, let me introduce all the speakers that you will hear during this session. First of all, we have Ali Samet, the DM coordinator and head of the Emergency Operations Center of the Red Cross of the Republic of North Macedonia. Ali, if you can hear us, maybe you can put your camera on. Work well for Ali, yeah, not yet. So hopefully, by the time of the panelist session, we hope that the sound will work better. So we will also hear from Dr. Mohamed Bendali, who is head of Division for Disaster Relief, Youth, Volunteering and Disaster Management from the Red Cross of Morocco.
Yes, welcome. Good morning. It's Morocco Red Crescent. It's not Red Cross.
I'm so sorry, of course. Morocco Red Crescent. Yeah, I sincerely apologize.
Yeah, thank you.
Yes, thank you for correcting me. Great. We also have Dr. Christy Monina Nalupta, who is Assistant Secretary General for Programs and Services from the Philippine Red Cross.
Yes, good morning to all, to each and everyone. Good morning.
Good morning. Thanks for joining. And we also have Namenya Zekic, the Deputy Secretary from Brčko District Branch from the Bosnia and Herzegovina Red Cross.
Hello to everybody. I'm glad that you all came to hear and to listen to what we have to say.
Thank you very much. So this will be our 4 panelists who will share with us their own learning from their own experience on how the efforts in the past have proven results in this COVID-19 pandemic. And the last but not the least, we also have Rachel MacLeod, who is Senior Disaster Law Officer from the IFAC Geneva office.
Good morning, everyone.
Good morning. Thanks for joining. And myself, sorry, I forgot to introduce myself. I am Malika Noisette, Response Preparedness Technical Advisor, and I'm here representing the Netherlands Red Cross. All right, so let's first start with a short video to bring us all on board of, the same understanding of epidemic preparedness.
Hi there, my name is Theo. I am a member of the Red Cross and Red Crescent response team. In this video, I'm going to talk about epidemics and what we can do to prepare for this type of hazard. Firstly, what are epidemics? An epidemic occurs when more people than usual have the same communicable disease in a particular location. A pandemic is when an outbreak of the same epidemic spreads across multiple countries. Epidemics affect the people who fall ill, but also have an impact on routine health services, the economy, education, and many other aspects of life. Unfortunately, epidemics are becoming more frequent. This is due to urbanization and destruction of natural habitat, climate change, international trade and travel, and changes in human interaction with animals. Talking about animals, did you know that the majority of epidemics over the past decade originated in animals? Both wild animals and livestock can pass on diseases, for example, through contact with infected animals or when we eat raw or undercooked animal products. Human, animal, and environmental health need to work together to prepare for and respond to epidemics. This is what we call the One Health approach. In our national society, we are using the Preparedness for Effective Response approach to prepare for emergencies. We know that reducing disaster risk and taking early action is essential. Together with the local authorities of our district, we identified some diseases that could spread and become epidemics. Our volunteers regularly organize health promotion activities. We encourage safe hygiene practices and the proper maintenance of water facilities. We also support immunization campaigns. This helps to prevent some epidemics from occurring in the first place. Often, epidemics go unnoticed until many people have become infected. Our national society works closely with health and animal workers, community and religious leaders, authorities, teachers, the private sector, and the media to make sure everyone knows about epidemics and what role they can play to prevent, detect, prepare for, and respond to them. When our national society updates contingency plans, we also make sure to consider the risk of epidemics that could be related to natural hazards. A few months ago, we trained Women's Association to prepare oral rehydration solution for children showing signs of diarrhea. This proved very useful when we had cases of cholera during the rainy season. School children also learned how to identify mosquito breeding sites to prevent the spread of dengue fever and malaria. Recent emergencies like COVID-19 have shown that we must be prepared to respond to epidemics, and we can.
All right, thank you very much. I hope everyone was able to see and to hear very well the video, which was a good introduction on how we understand epidemic preparedness within the movement. So what I would like to share with you before the panel session are a few key findings from a very interesting study that was led by the IFRC, which is called National Society Preparedness Contribution to the COVID-19 Response. And the aim of this study was to gather lessons learned on how the preparedness efforts of the national societies have contributed to a better response to the COVID-19 pandemic. So it was made globally from very different experience from different national societies through desk study and interviews as well. So I won't go into too much details, but just to share with you the key highlights. One of the findings was that, for example, it showed that the efforts that were put in response preparedness were useful to all types of disasters and showed benefit even to different types of disasters. So let's say if a national society invested more efforts, for instance, on flood preparedness, yet a lot of the mechanisms that they had put in place were also very useful for the response to this pandemic. So that's really interesting. Of course, we don't have to repeat, all those different efforts for all different types of disasters. Another lesson was that the national societies who applied multi-hazard preparedness planning were better able to adapt to the situation and to respond to the COVID-19 in addition to their ongoing activities, and also subsequently when more hazards came in and they had to deal with several hazards, they were better able to adapt and to have enough capacities to address the complexity of multiple disasters. Another finding was that, as you've heard in the presentation, it concerns the preparedness for effective response approach, which is an approach which is now widely used within the movement to support the reinforcement of the capacities of the national societies. And through this approach, the national societies are really on the driving seat of assessing their capacities, prioritizing what they want to improve, and establishing a work plan that will help them improve those capacities. And it turned out that a lot of components that were scored quite low in the assessment were actually not prioritized in the work plan, yet those components turned out to be very critical in the response to the COVID-19 pandemic. So, for instance, the component of business continuity planning, resource mobilization, disaster law, advocacy and dissemination, DRM policies, and cash, for example, were a bit underestimated in their level of importance. So this kind of reality check was also a good lesson to help us also see, which kind of components should really be prioritized for our flexibility to be able to respond well to any type of unforeseen challenges. Another example was, for instance, the operational learning that was institutionalized by the DREF team on always assessing, reviewing the DREF and the different learnings from the different DREF's operation, and registering all those lessons learned and challenges, tagging them against the PR benchmark, really also help to have a better picture of the strengths and weaknesses of the national societies in emergency capacities, and which areas should also be prioritized to reinforce, again, to be better equipped to unforeseen challenges. And the last one that I wanted to share with you was the fact that it showed that national societies who had embarked in the PER process or who received long-term support from other partners on preparedness strengthening were also able to show better results in the response and to fulfill better their mandate to the auxiliary role to the authorities. So that was, another positive outcome of this study. So now, without further ado, I will call all the panelists to start the panel session. And now we are going to hear directly from them, from those different countries, to what extent as well the effort they have put in the past in strengthening their capacities to emergency response help them to respond to the COVID-19 pandemic. So again, if anyone joined the meeting after the few words of introduction, I just want to remind you that translation is available. If you wish, you have an interpretation button at the bottom of the window. You can click on it and you have translation in French and in Arabic available. Okay, so let's start with the first questions to the panelists. The first question is, how do you think that your investment in institutional emergency preparedness for various types of hazards has helped your national society to respond more effectively to the COVID-19 pandemic? So I will first call Dr. Mohamed Bendali from Morocco Red Crescent.
Yeah. Merci. Bon, merci pour cette introduction et merci pour l'organisation aussi. Merci de m'avoir donné l'opportunité de participer à cet événement. Avant tout, je félicite toute la communauté Croix-Rouge, Croissant-Rouge pour l'organisation et la création de Red Summit. Effectivement, le Croissant-Rouge, depuis 2009, a toujours préparé son plan de contingence selon les règles de l'art. Il a acquis de l'expertise pour former et prendre le lead et l'animation du plan de contingence interagence ici au Maroc pendant 5 ans, depuis 2010 jusqu'à 2015, et nous continuons à réunir toutes les synergies pour réussir le plan de contingence. Dans notre plan de contingence des 5 dernières années, et selon l'étude des risques, les plus probables, nous avons préparé pour 3 contingents. Alors, les 3 contingents, il s'agit des inondations, les tremblements de terre et le mouvement de foule et la violence. Et ce troisième, il est très lié à lorsqu'on a parlé de la crise d'Ebola en Afrique. Dans chaque contingent, beaucoup de secteurs ont été couverts, vu notre mandat. Et j'insiste sur le mandat parce que ça donne plus de préparation et de force et de choisir les secteurs dans lesquels il faut renforcer la préparation institutionnelle. Donc, notre mandat avec le ministère de l'Intérieur, la Protection civile et le ministère de la Santé. La composante santé est cruciale à prendre en considération. En effet, notre présence dans toutes les provinces de façon décentralisée et notre action de proximité nous a facilité l'accès aux populations. Et ça, c'est un point aussi à préparer et à prendre en considération dans cette préparation institutionnelle. Les actions que le Croissant Rouge marocain a entreprises étaient incontournables et les volontaires ont été très sollicités par les autorités pour accompagner dans la sensibilisation pour le respect des gestes barrières. Le respect du confinement, l'accompagnement des personnes isolées dans les centres d'hébergement et les hôtels, le transport, la désinfection des lieux et des transports publics, l'accompagnement des personnes vulnérables dans les soins à domicile et des injections et des petites mesures soit de tension, soit de glycémie. Et en utilisant le réseau des cliniques du Croissant Rouge au nord du Maroc, nous avons créé un hôpital de campagne d'où ont transité au moins 4000 cas positifs. Aussi, nous avons mis à la disposition des autorités sanitaires de personnel qualifié comme médecins, infirmiers, et aussi nous avons mis aussi les lauréats des écoles de santé du Croissant Rouge, aussi bien au nord qu'à Casablanca. La composante aussi soutien psychologique et de coutume et de façon transversale. Aussi, nous avons organisé des campagnes de dons de sang et aussi des campagnes sur la vaccination des enfants et la promotion de la santé de la mère et de l'enfant. Quant à la vaccination contre la COVID-19, Depuis son lancement, le 28 janvier 2021, par Sa Majesté le roi Mohammed VI, que Dieu l'assiste, environ 4700 ont accompagné ce chantier et continuent à le supporter jusqu'à maintenant depuis la promotion, surtout sur la communication des risques et l'engagement communautaire, l'enregistrement dans la base de données, la consultation, la réalisation de l'acte vaccinal, puis jusqu'à l'activation du passeport vaccinal. Nous sommes et nous étions convaincus que tout travail doit être préparé. Cette implication vient du fait que la préparation institutionnelle et opérationnelle des volontaires et par des simulations a bien eu sa valeur ajoutée. Aussi, la reconnaissance, la protection et la promotion des volontaires, il doit être bien pris en compte. Et juillet dernier, je remercie la Croix-Rouge allemande et la Fédération pour nous avoir permis un exercice d'évaluation PIA, plusieurs recommandations qui ont été sorties et qui vont renforcer notre présence et notre mission pour donner plus d'efficacité à notre intervention. Merci.
Merci beaucoup à vous, Dr. Bendali. Thank you very much. It was, very insightful. I would like to, just mention to all participants that when I raise my hand towards the end of the response, it's not that I have a question, it's just to inform our panelists that there is only 30 seconds remaining for their answers. So, just as a point of clarification. Thank you so much once again. Now we will hear from the Philippine Red Cross, from Dr. Christy Monina Nalupta.
Yes, good day. Good day, Malika. Good day to all who joined this session and to my co-panelists and our moderator. Good afternoon from the Philippine Red Cross. We have found ourselves in a global battle with all of humanity facing a common unseen enemy, the COVID-19 virus. By now, the pandemic has tragically taken hundreds of thousands of lives, infected millions of people, and upended the global economy. In the Philippines, we already have 2,683,037 cases since the declaration of pandemic, with active cases of 82,228 individuals and positivity rate of 15.5%. The Philippine Red Cross needs to be responsive to the complex requirements of the country and recognize that the pandemic demands a well-coordinated, decisive, and innovative action from the organization. The overall goal of the humanitarian preparedness and response is to support the nation in strengthening the health system and upholding the overall safety and well-being of people at risk, and especially the most vulnerable groups, and to delay the spread of infection. Preparedness can be attributed to knowing and focusing what the directions will be to combat COVID-19 with available resources like manpower, those experts in the field of science, or interdisciplinary experts like the contact tracers, and with available resources, logistical, and equipment. So, a proactive and strategic overall plan with a clear 4-pillar strategy was developed and well articulated and communicated across the entire response architecture of the Philippine Red Cross. These strategies were rapidly adapted and adjusted to the pandemic response, and the COVID-19 response of the PRC centered on 4 pillars, namely surveillance, support to healthcare system and authorities, community action, and business continuity. The report is to focus on pillar number 2, and that is the support to healthcare system and authorities. The PRC mobilized early and comprehensively supporting the government on the health response while continuing and expanding the provision of other life-saving humanitarian responses or assistance and putting in place instruments for operation response. Centered on pillar number 2, the objective is to fight off COVID infection and prevent it spread further. Initially, the PRC had to focus on 3 Ts, and that is testing, tracing, and treating. Detect and diagnose all suspected or persons under investigation cases, strengthen surveillance and laboratory testing to improve the understanding of COVID-19 epidemiology in the country, and strengthen test, trace, and track capabilities. On health responses, the PRC had to focus its resources on molecular laboratory for COVID-19 testing, isolation units, field hospitals and medical tents, and later on, the vaccination program to cover prevention. The PRC had its first PRC molecular laboratory in April 2020, which augmented the testing capacity in the National Capital Region, a densely populated urban area and the ground zero of infection. In this key city, additional PRC laboratories were established to complete a 4-laboratory setup that can perform almost 22,000 RT-PCR tests per day. We expanded further to assist the needs of other areas in provinces where there was a gap in COVID-19 testing. To date, the organization has a total of 14 molecular laboratories in the country and has already tested more than or almost 4.5 million individuals through RT-PCR testing, accounting to a quarter to the total tests in the entire country. The latest area with the laboratory is situated in Mindanao. The National Capital Region, the PRC test 1 out of every 4 individuals and 1 in every 5 individuals on a national scale. The response plan is also focused on providing critical health intervention like the setup of isolation facilities concentrated in the NCR to immediately isolate COVID-infected individuals in the community, including the Red Cross staff and volunteers. The objective, of course, is to reduce transmission, slow down, suppress, and stop virus transmission by minimizing the risk of infection through isolation or quarantine of confirmed cases by making available a facility-based isolation and treatment cases. So to date, the PRC has 7 isolation facilities with a total of 416 beds with management of the daily operation in coordination with respective local government unit. The evolving nature of COVID-19 virus lead to the birth of different variants with Delta variant, known of its high transmissibility. With hospital care utilization rate reached its full capacity, the Red Cross has to establish its first COVID-19 emergency field hospital. So our EFH is under the auspices of the Lung Center of the Philippines, a licensed tertiary hospital. So it has a 70-bed capacity field hospital and already has treated more than 300 patients. So aside from that, the Red Cross has medical tents and actually has provided 70 medical tents in 32 hospitals nationwide. And it is actually used for triaging unit. So to cover the preventive side, we also have 24 vaccination centers. And with 24 vaccination centers, we already have actually vaccinated almost 300, if I'm not mistaken, 350,000 individuals. So basically, that is the support provided and the responses provided by the Philippine Red Cross to the country. Thank you very much and good afternoon to all.
Thank you very much to you for sharing this very impressive story as well. I mean, not story, but real reality on the ground and real, very concrete achievement. Now we will hear from Ali Samet from Macedonia, if the sound works. I'm not sure it will work. Mr. Ali Samet, are you able to speak? Yes. We cannot hear you. No, we can see you from the side, but we cannot hear you, unfortunately. So let's first hear from Nemanja Zekic, and then we'll come back to you in case in the next 5 minutes the sound is sorted. So yes, Nemanja Zekic from Bosnia and Herzegovina, over to you.
Thank you, Malika. So, my topic is to talk about branch preparedness and how it helped us respond to this global challenge that we all faced. And one thing is sure, is that you are never going to be prepared for every hazard that may happen. And the beginning of this pandemic proved that to be true. What we did here in our branch was that before this emergency started, we did the multi-hazard approach because of planning, because we live in an area that is prone to disasters, which has several hazards, and mainly affected by floods and landslides. So we, in our preparedness, invested in emergency operations center, in radio communication, in ambulance vehicles, and which is most important, in human resources, because that is the thing that is going to drive your operation forward, but that is also the thing that will make all of the other investments possible to actually implement in the state of emergency. What we also did was to have a small personal protective equipment, not bearing in mind the epidemics, because as we did assessments before this pandemic started, we didn't think that those were much of a risk at that time, but we did that because we thought, and our experience said, that it is going to be useful in the floods, especially because you do have diseases after the floods for affected populations. So those initial personal protective equipment stock in our district with the Red Cross was the only stock for all the services, including the government. And all of that investment enabled us to support at first the vulnerable population of our district. At the beginning, for the first 4 months, we did more than 1,500 distributions to elderly, to people at risk, going and taking the humanitarian aid to their homes and coordinating the operation through the call center and through the radio communication that we already established, an emergency operations center. The other activity is that our investment in ambulance vehicle actually proved to be crucial, because currently, together with the local health center, we are doing the transportation of people positive to COVID-19, and we have done more than 2,500 transportations since the beginning of this year. And in 2020, it was used to transport the people who came back to Bosnia from abroad and who had to self-isolate for 14 days. And it was the task of the Red Cross to bring all of those people home to Brčko, of course, for people who are from Brčko district. Eventually, our continuous investment, especially in the human resources, enabled us to have a crucial role in vaccination efforts, which means that Red Cross is completely in charge of information management for the entire vaccination process, and that wouldn't be possible maybe 2 years ago. We recognize that as something that is going to be the future of all emergency operations. It proved to be right. So currently, all the people who want to be vaccinated, they need to call the call center of the Red Cross, which then makes appointments and coordinate the entire information management, but also the activities at the vaccination point, which means that currently we made over 30,000 appointments up to date, with waiting times at the vaccination point of only 15 minutes. So everybody who was vaccinated here in our district had to be coordinated by the Red Cross, and no one had to wait more than 15 minutes, which was especially important for people who are vulnerable, who have disabilities, or elderly population. So that is from my side for this first question. Thank you.
Excellent, very impressive as well. Thank you very much, Nemanja Zekic. Let's give another try to Mr. Ali Samet to see if the sound is working. Hello, Ali? No, it's not. Okay, sorry. So let me not. Yeah, in case you think it works, feel free to let us know for the next questions. Otherwise, I will not, disturb you again. But yeah, really sorry about this. If you want to share, some insight as well from what you wanted to say, feel free to also add a few bullet points in the chat so that people also, get to hear from your experience. Feel free to use the chat box for this. Okay, sorry about this technical challenge. So now let's move to the next point. And I will call Dr. Christy Monina Nalupta to first share about us, about any new response mechanisms that you might have developed to respond to the COVID-19 pandemic. So did this pandemic lead you to develop some new specific response mechanisms? And do you think that those mechanisms will be sustained in the future beyond the response to this pandemic?
Yes, thank you, Malika, for the question. Definitely, there are a lot of new response mechanisms that we were able to develop for COVID-19. Let's take, for example, our call center. We have a vanity line, and that this vanity line is 1158, dedicated for COVID-19 response queries. So aside from that, definitely, we were able to actually establish 14 molecular laboratories, and that's unique to the Philippine Red Cross and perhaps to the movement. And another new mechanism is the isolation facility for COVID-19 individuals, infected individuals. Aside from that, although we've been actually having emergency field hospital, but the new mechanism is that this emergency field hospital is under the auspices of a tertiary hospital, wherein we have experts in the field of pulmonary medicine, internal medicine, and manning also this emergency field hospital, or our nurses, our volunteers, and admin staff. Aside from that, really new to us, is having 6 negative pressure ambulances for COVID-19 patients, and motorcycles who can deliver the swab and saliva sample collection and blood units. We know that there are difficulties in going to laboratories or even blood banks, so we offer our delivery through the motorcycle units that we have. Actually, we have 104 motorcycles, and not very new, but we would also want to have a special mention our Bakuna Center, because basically we just had about a year ago, or before the pandemic, we've been engaged with polio and measles vaccination because of the outbreak in the country prior to the pandemic. So we just continued with the expertise that we have, with the resources that we have. We just continued servicing the people or the community through our Bakuna centers by deployment of technical staff, or even establishing our Bakuna Center. And one specific new intervention is having a vaccination mobile clinic or bus. So aside from that, definitely we have one convalescent plasma center who catered to about 1,400 plus patients needing this COVID-19 plasmas from recovered patients. And of course, the business continuity, in which we were able to develop a risk assessment team who would help in assisting our COVID-19 staff and volunteers, or even some of its family extended to some of the family members of the Philippine Red Cross. So that's all for us. Thank you.
Perfect. Thank you very much. Indeed, I mean, we are happy to see that a lot of those new capacities will definitely be sustained and be available for the future as well. As we can see, the response capacities that will build under emergency time are often very technical and very specific capacities. But what we've had as well from the first insight or response that we had on the first questions is that everything that was built in the past in terms of mechanisms were things that are less specific, but that are mechanisms that indeed can be used for different types of disasters. So all the issues of having contingency planning, developing access of the volunteers to the communities, issues around mandates. You also discussing your very proactive work on strategic planning, for instance. We also heard about volunteers management or building emergency operation centers. All these kinds of capacities indeed must be built before an emergency because they're quite heavy and they can be used for different types of hazards. But during emergency, we don't have much time to build those kind of capacities, and it's really important to get this work done before. Also, we had from the first question, the capacity also to deal with multiple hazards, which gives a lot of flexibility to be able to adapt, because as we know, things never really happen always. I mean, it never happened the way we expected it to happen exactly. So multi-hazard capacities also build this kind of flexibility to adapt to the situation. And indeed, when we have large-scale emergencies like this one, it's also an opportunity to also develop more specific skills, which are very necessary. And if we do it well, indeed, it can be sustained for other emergencies. So thank you very much. We were supposed to hear from Mr. Ali Samet on this question, but I don't think the sound will work. So I want to give the opportunity to maybe the other panelists as well to say something on this. So if you want to share some specific response mechanisms that you developed. I can see that Ali has connected again. So should we give it another try? Alisa, I'm being told that you are back.
Do you hear me now?
Yes.
Oh, definitely.
Thank you very well.
Sorry for my failed communication, but I tried in the 3 computer I changed, but anyway, thank you very much for your attention. Thank you.
Okay, wonderful.
Do you hear me good?
Yes, very well, and I'm very happy about this. So if you want, you can actually speak about the 2 questions at once. So we'd be happy to hear, what kind of capacities you have built in the past on response preparedness that you were able to mobilize and to use in this COVID-19 pandemic. And also if this response to the pandemic was the opportunity to develop new response mechanisms that might or might not be sustained in the future. So I will give you ample time to respond to both questions at once.
Okay, because I lose my time, I will be really short. I don't want to repeat my colleague, because same everywhere in the world with same activity we have. Especially what is important for for Red Cross of Macedonia is really important, because during the COVID-19 we opened the emergency operational center. But also because in the Macedonian Red Cross is part of government, we use next application, next generation incident command system. what is next generation incident command center? It is web-based interactive GIS tool. During the COVID-19, and still we use in the NICS incident command system this web application. But what is important for this system? This web application is really important for development, for coordination, communication, map development in case of disaster, normally for COVID-19, interagency communication and coordination. Is really important for Red Cross because it's possibility see all activity in the Red Cross during in the crisis immediately and etc. Also, it's really this web application is really important, possible for cross-border activity. Also, it's really important for data and storage of server, interagency cooperation, data exchange, text, photo, and video in real time. Every day. Also, it's really important because for each organization who is in the part of crisis management center is tracking of movement of resources in real time. It's really important tracking for all our teams during in the field. We can see everything in the visibility. And possible for also is possible open space for Red Cross branches, communication and monitoring of teams and mapping. Monitoring of activity of growth also is really important because this NIC application only for stakeholders, normally for government we use, but it's really interesting. We open for public. We open the one link for public, and the public can see every day, every moment, every second, or activity and database of each operation for COVID-19. This is really important. We first time and we start in the using. And for us was really important because people who work in the emergency operational center, we have each moment for each figures, database, and etc. We can react it and give the proposal for other activity. This is really important. We are part of the government, and we use this NICS web application call in the NICS. You can open the in the website. You can read in the more about NICS for this web application. And interesting in the regional level in the Balkans countries, Southeast Europe, every neighboring country also we use in the NICS application. We can change the database information, ask for some opinion and for proposal and etc. This is shortly about for our activity, but it's important. And normally, Macedonia Red Cross of North Macedonia work same with other country, other activity. Thank you for your attention. Sorry for my failed communication in the beginning.
No problem at all. At least we managed to hear from you, and that's really great. Thank you so much for this. You also.
I will send in the I will send in the chat about in the NICS how we use.
Okay. Yes. Great. Super. That would be wonderful. Yeah. Thank you so much, because I'm sure many participants will be very interested in this. And it was really a great opportunity to hear about, different types of work as well. That is very important for emergency response, like what you mentioned around coordination efforts, capacity mapping, resource tracking as well. All those systems that must be built, prior to an emergency, and that increase a lot the effectiveness of the response and the speed of the response in terms of disasters. So thank you so much. Very happy that we finally managed to hear from you. I also, before moving to the next question, and before I forget, I realized that someone asked about the link to the report that I mentioned at the beginning about the few findings that I mentioned. So this report is not yet available. It's still going through on the final. It's still going through some final editing, so we can share it today. But I think it won't take long before it's finalized, and it will be shared widely, definitely, especially through the PIA colleagues that will try to reach, of course, as many people as possible. All right, so now let's move to our last point of discussion with our panelists, which is about some key lessons on institutional preparedness. So to our next speakers, I will ask you what kind of lessons have you learned through this COVID-19 pandemic response in terms of the capacities that you've built through institutional preparedness, and what can you share with us about this? It can be from this pandemic, or of course from from previous emergencies as well, things that can help us improve as well in this area. So yeah, first we can hear from you, Dr. Mohamed Ben Dali.
Thank you, Malika. Merci. Pour être bref, c'est que la société nationale doit agir dans le respect de son rôle d'auxiliaire des pouvoirs publics dans le domaine humanitaire. Deuxième point, développer son acceptance et le respect des principes et valeurs humanitaires. Troisième point, développer la composante accès sûr et sécurité. Quatrième point, nouer des contacts avec les partenaires clés et définir un mandat bien clair. Intégrer la composante des épidémies dans les plans de contingence de la société nationale, s'aligner avec la stratégie nationale sur la gestion des risques aux côtés du ministère de l'Intérieur, tout en restant aligné avec tous les défis et les axes de la stratégie 2030 de la Fédération, développer le sens de responsabilité de comportement avec la population par le renforcement de la communication, surtout ce point-là est très important à développer et trouver quelque chose qui peut le renforcer dans la société nationale, renforcer les conditions dans lesquelles les volontaires travaillent dans les situations d'urgence. Merci.
Très bien, merci beaucoup. Thank you very much. It's very helpful to hear from you, what are the priority areas that you found the most important to reinforce when improving your capacities to respond, because that's, as it was mentioned earlier in this session, identifying indeed the key areas that will play a very important role in an unexpected emergency operation is something that is indeed critical, so that we don't spread thin our resources to different aspects that might not actually add much value in case of emergency. So that's very interesting, and it really cut across several PIA components. So it's always good to make this connection as well. Thank you very much. Encore merci. Now we'll give the mic to Nemanja Zekic to also share with us your learnings.
Thank you, Malika. So in preparation for this meeting, we had discussions internally, and we decided that maybe these are the 5 most important lessons that we learned. And the first one shouldn't be news to anybody, is that safety needs to come first. So basically, whatever we do, especially during the pandemic, we need to take care of our people, especially with the protection equipment, not only during the pandemic, but in general. Everybody needs to be insured, and all the procedures that we do on the ground need to take this into account. The second one is that we need to be proactive. There are in the field many bigger stakeholders than the Red Cross, but our advantage is that we act fast and that we leave no one behind. So when I mean that we need to be proactive, that means that we should be faster in reaction to emergencies than maybe government bodies, which often are not. The third lesson is that all the preparedness that we talked about a lot today doesn't happen in a vacuum. You need to identify the gaps that you see in your community, in the preparedness of your community, and then to offer solutions, to build capacities in order to bridge those gaps. And then whenever emergency strikes, and for most of emergencies that can happen, you will have a clear role and all the investment in preparedness would pay off. The fourth one is that we all need to keep learning. At the beginning of this pandemic, I believe that, well, many national societies didn't have any idea about the virus, and then several of the national societies maybe had some idea. But we kept learning throughout the pandemic, and currently we work together with the World Health Organization, with health authorities, because we continued to learn about the pandemic, to learn about the virus. And finally, is to, as much as possible, to use the strength of the international movement of Red Cross and Red Crescent societies, especially because that is something that none of the other actors in the field has, which proves us, which gives us the opportunity to mobilize not only resources, but knowledge, but know-how of other national societies, where we could hear today interesting elaborations of how they did it in other countries. But also you can ask for advice, you can ask for equipment, whatever is possible within the national community can come and support your operation, from my experience, in a really short amount of time. So thank you, that would be all for this question.
Thank you very much for this very complimentary response as well. Yes, indeed, volunteers insurance is something that came all of a sudden very high in many national societies' agenda due to this pandemic, and made a lot of under all types of situation to have some very important volunteers management and protection in place. Great, thank you very much once again. Since we're a little bit ahead of time, I just wanted to ask if Alice Ahmed or if Dr. Christine Monina Nalupta had something to share on this as well, on specific key lessons that you would like to learn on how to build institutional preparedness capacities. Feel free to share with us.
Thank you. Do you hear me?
Yeah, very well.
Lesson learned. I think this during the COVID-19, we really improved the communication with crisis management center, with government, with other organizations. This is one of the best, because we improve our communication, and we can share or show our capacity, human, material, technical resources. And during the 19 is Red Cross was really active. But it's important because we important in the government level our position in the Red Cross. If we really improve, and this is good for our future.
Super, wonderful. Thank you very much for this great addition, Alice Ahmed. Yes, Dr. Monina Nalupta?
Yes, for the Philippine Red Cross, Malika, I think one of the best lessons that we learned from this pandemic is that no one really is prepared for this pandemic. But because you have already developed a partnership, basically with stakeholders and other partners, in the community, like having a pool of resources like human resources and volunteers all over the country that can really help in your response operation in regard to the pandemic that we are experiencing right now. So, what Nemanja was able to mention earlier, the movement is really one of the best partner which you can turn to, especially in asking for or capacitating one's national society and helping build the society. Be prepared always. And what else? Definitely. The people itself, the expert itself in the Red Cross, the people or the resources of the human Red Cross is what made the difference. Specifically, the leadership. Thank you.
Yes, thank you so much for this. Indeed, we can see that, from the different contribution we've had from other panelists, there are different specific components of emergency response that are very cross-cutting and that are very necessary under any types of emergencies. As it was rightly mentioned by several of you, we can't be 100% prepared to everything, and we can't know exactly what will happen. But at least by having those core components to a minimum standard helps a lot to deliver the expected support that is expected from the government and from the affected communities, of course. And we can see as well that there are some cross-cutting themes, but there are also different priorities according to the national societies. So going through this learning as well from past experience or using as well the PR approach can really help well to define the specific priorities for your own context, for your own national society, to be able really to invest in the most important component, which will make you flexible enough to adapt to any kind of situation. Great. So this is the end of the panel session. So I would like to thank all of you very, very much for your very insightful contribution. We might have a small Q&A session at the end. So please stay with us in case any question is directed to you. But for now, I will pass on the mic to our colleague from the IFRC, Rachel MacLeod, who will share with us some specific findings and recommendations as well from a study which was made around disaster law, and to what extent our efforts in reinforcing this component or our gaps have been of help or challenging in the response to the pandemic. So she will share the findings and have a small video as well. So Rachel, over to you for this specific disaster law focus.
Great, thank you very much, Malika, for the introduction. So I'm a member of IFRC's disaster law team. We're a team of 17 with regional and in-country offices around the world. There's actually just 2 of us in Geneva. The rest of the team are spread out throughout the whole entire world. We work in 3 main areas. So firstly, in partnership with national societies, we assist governments to strengthen their domestic disaster laws, policies and plans. Second, we conduct capacity building on disaster law. And third, we conduct publish research and guidance on all aspects of disaster law. So in July of this year, we launched a new research report focusing on how domestic laws policies and plans can support preparedness and response for public health emergencies. So I have here a copy of the report. The full title of the report is Law and Public Health Emergency Preparedness and Response, Lessons from the COVID-19 Pandemic. But I'll simply refer to it as the PHE report. And I'll also just refer to public health emergencies as PHEs as well, just to save a little bit of time. So this report that I just showed you, it's based on country level research, which we undertook in 2020. There were actually two different phases of research. So firstly, at the very beginning of the pandemic, we were concerned about how the restrictions being introduced were impacting on national societies and other humanitarian actors. And we were also concerned about whether or not national societies and humanitarian actors were being fully included in the coordination mechanisms being used by government. So at the very beginning of the pandemic, between March and May of 2020, we did a mapping of the emergency decrees in 113 countries, focusing on whether humanitarian actors were provided with exemptions from restrictions and whether they were included in coordination mechanisms. Of course, as the pandemic progressed, many extra legal issues emerged, and in many cases, the pandemic began to highlight the inadequacy of existing laws, policies, and plans. So at this stage, we decided to do a second phase of research to better understand domestic legal frameworks relating to public health emergencies and how these relate to the domestic legal frameworks for disasters generally. In the second phase of research, we looked at a much smaller number of countries. So we just looked at 32 compared to the 113 countries that we looked at in the first phase of research. But we looked in a lot more detail, and we were really trying to understand the full picture of the legal and institutional frameworks for public health emergencies in those 32 countries. In this second phase of research, we also deliberately selected countries that had experienced a significant public health emergency in the relatively recent past, such as Ebola, Zika, SARS, or MERS, so that we could understand not just what happened during COVID, but what had also happened in the response to those previous public health emergencies. So the report, which I just showed you before, it analyzes the information gathered in these two different phases of research, and it addresses a very broad range of topics and provides a comprehensive set of recommendations about how domestic laws, policies, and plans can support preparedness and response for public health emergencies. So I don't have time today to take you through all of the findings and recommendations. If you are interested, then I would recommend going to the executive summary at the very start of the report, just to get a concise overview of the findings and recommendations. But there are a few recommendations and findings that I would like to highlight for you today. One of the most important findings is that a significant number of the countries that we looked at in the second phase of research have quite old public health emergency laws. Some of the countries even had laws dating as far back as the late 1800s or the early 1900s. Of course, the fact that a law is old does not necessarily make it weak or ineffective. But in our research, we did find that these older laws tended to have some problematic features. So, for example, they tended to take the approach of creating a list of all of the different diseases or illnesses to which they apply. But the problem with this is that it means that the laws are not applicable to new and emerging health risks. And in some cases, the older laws even referred to health risks that are no longer widely prevalent. For example, smallpox, which the WHO declared as eradicated in 1980. Some other key findings that I think it's worth highlighting are that for many of the countries that were surveyed, the main laws relating to public health emergencies do not address risk reduction in detail. They have scope to have clearer and more detailed arrangements for preparedness, especially contingency planning and early warning. And in many cases, the laws did not reflect an all of society and all of government approach that facilitates the involvement of all of the different relevant actors and stakeholders. So, based on these findings, we recommend that laws, policies and plans relating to public health emergencies need to be reviewed and updated regularly to ensure that they are fit for purpose and comprehensively address all key phases and aspects of managing public health emergencies. So in the disaster law team, we expect and certainly we hope that the COVID-19 pandemic will be a catalyst for governments around the world to review and update their laws, policies and plans for public health emergencies. And we stand ready to assist them in this process. To make the recommendations in the report accessible and a lot shorter, we've prepared a short guidance document, which I'm showing you here. And this guidance document is actually in a pilot version, so it's not been finalised yet. It's open for consultation until the 31st of October, after which it will be finalised and it will become part of the suite of tools that we use in our work. So I would really encourage you to look at both the report and the guidance. They are both available on the homepage of our website. Our website is simply disasterlaw.ifrc.org. And of course, if you have any comments that you would like to share on the guidance, please do so. You can actually email me directly. I'll be very, very happy to hear from you. So what I would like to do now is I would like to just leave you with a short video which summarizes the recommendations in the report. I hope you enjoyed this video. Let me
Okay, thanks again, Rachel, for this very interesting explanations on all the work that you have done around disaster law. So now we still have a bit of time to answer the questions from the participants, which is great. I have seen in the chat that there was one question which concerns, I think, all panelists. So be ready, all of you, to respond if you have something specific to share on this. And the question was, could you share with us your main challenges that you've been facing in the response to this COVID-19 pandemics? And indeed, we've discussed a lot about successes and what we have learned in terms of what worked well from our previous efforts. But it's also important to share the challenges that we've had. So I will let you speak in the order that you want. If one panelist is ready to answer this question, feel free to just switch on your camera and speak. Okay, so let's start maybe with the... Yes, okay.
Bon, à propos des défis, donc nous avons plusieurs défis. Le premier, c'est l'accès humanitaire et la portée au groupe de population touchée, parfois limitée en raison des conséquences de l'épidémie. Le deuxième point, c'est la propagation de la peur, la méfiance et de la désinformation sur le COVID-19 et les risques de stigmatisation. Un troisième point, c'est le renforcement des capacités opérationnelles au niveau central. Le quatrième point, ce sont les besoins accrus en formation et leur qualité à tous les niveaux, au niveau national, régional et provincial et local. Un autre point, c'est la promouvoir un environnement favorable pour tous les volontaires, offrir des motivations et un soutien aux volontaires, renforcer la protection juridique des volontaires, améliorer les conditions dans lesquelles les volontaires travaillent dans les situations d'urgence, assurer la continuité et la pérennité des services pendant plusieurs semaines consécutives, surtout concernant la disponibilité des volontaires formés, et comment la société nationale peut-elle jouer son rôle d'auxiliaire auprès des pouvoirs publics à l'ère de la révolution technologique. Voilà, ce sont les points que je peux partager avec vous sur les défis que nous avons rencontrés sur notre intervention au niveau concernant la COVID-19. Voilà, merci.
Très bien, parfait. Merci beaucoup. Thank you very much for sharing those. Now we will hear from Dr. Christy Monina Naluta. Over to you.
Yeah, I think I have heard Dr. Mohammed mentioning volunteers. Same with the Philippine Red Cross. We had a hard time looking for more volunteers, especially those experts in the field of health, the one who can really assist us with manning our bakuna centers or isolation facilities. One of the reasons why we have some challenges, because of course because of the burden, or perhaps our healthcare workers or our frontliners are already burdened and drained, so less and less volunteers are coming to our facilities to help and assist in this response operations. And during the beginning of our molecular laboratory operation, one of the big challenge that we have hurdled is information technology, on how we can best use the technology in releasing an immediate result for RT-PCR. So during that time, while we were already operating our molecular laboratory, we have to develop programs so that we can immediately use the online technology in requesting for RT-PCR tests and in releasing the results of the RT-PCR test. So basically, those were some of the challenges of the Philippine Red Cross. Thank you.
Thank you so much for sharing those. Yes, now I can see that Nemanja Zekic also has something to share. So over to you.
Yes. Firstly, I would like to agree with the colleagues who spoke before me, because with this global pandemic, we are talking about the emergency that is lasting, 1.5 years now, almost 2 years. It is hard to keep the number of competent volunteers throughout this period of time, because it is happening every day and it is happening for such a long period of time. So I would agree with them. But also another big challenge, which was really relevant at the beginning, is like when disaster comes, even if it's a global crisis like we have now, the help, the support would come. But at the beginning, when there is no enough information, when there is a lot of fear, and when there is a big need to act, you need to be ready to act on your own until the support comes. That was a big challenge, and I believe that many of our good results that came later were actually based on this first period of time when we were ready, thanks to our preparedness, to act on our own for the first, let's say, maybe 1.5 months. Thank you.
Thank you so much. Yeah, indeed, as you mentioned, we speak about learnings, but it doesn't mean that this pandemic is over. We are still in it. We are still dealing with it, and it's now dragging on for so long. And that's also another part of the unexpected that we have to deal with, which is the duration of this crisis. And for some countries which have to deal with chronic crisis, they might be used to this, but for other countries, the duration of this operation and the length might also be another challenge to deal with. Thank you very much. Ali Samet, would you also like to share something on the main challenges you have faced in the COVID-19 response so far?
Yes, I will be fast again. But I think that it's we improve in our position in the government level. But also, I want to say that for future we must do things which kind of activity we accept. This is will be some negative side, because it's my experience was in the really negative side, because it's always in the government, Ministry Health, Ministry Interior, and other ministry, Crisis Management Center, always in the call, and the Red Cross do it. But for future, when we prepare our contingency planning, and normally in scenario inside 1, 2, 3 different scenario, we must be careful for future which kind of activity we take, especially with volunteers. Thank you.
Exactly. Thank you so much, Ania. Dealing with all those very high expectations are not easy, and when we define in advance what will be our role as well in the response, it also helps maybe to narrow down a little bit expectations that might put the national society under a very tense situation. Great, thank you very much for sharing this, Ali Samet. I've not seen more questions in the chat. So if any participant would like to ask a question, we still have about 2 minutes to answer questions. Feel free to unmute directly and ask a question to one of our panelists or all of them. I don't see any hands or anyone unmuting. So then I would like just to use the last 2 minutes to ask maybe each panelist if you... yes, someone has a hand raised. No, sorry, it was a mistake. No. Okay, so if maybe, yeah, we might not have time to hear from all panelists, but if maybe 1 or 2 of you have one last key recommendation to share on what, based on all this learning, what would be your number 1 priority in terms of reinforcing your preparedness capacities. If something pops up from your mind, feel free to just unmute and chat to any panelist. Just briefly, because then we will close. Yeah. Yes.
It's the people. Everything starts with the people, everything ends with people. So investment in volunteers, in staff, always pays off. It should always be a priority before equipment and goods. And that is something that can always make us adapt to the changing environment where we act.
Excellent. Thank you so much, Nemanja, for indeed sharing this very important point. We've spoken a lot about auxiliary role and institutional capacities, but indeed the people are really the first one that should define our priorities. Yes, Dr. Vandali, I can see
oui,
you have...
effectivement. Donc, moi, je reste toujours sur notre rôle et notre mission. C'est la première priorité, c'est de garder son acceptance et développer tout ce qui est information, éducation de la population sur la RCCI. Voilà, merci.
Parfait. Merci beaucoup pour ça. I would like, now we are coming to the end of our session, so I would like to again thank all participants for joining and all panelists as well as Rachel MacLeod for sharing with us those very inspiring learning. We hope it was an inspiring session to all of you. Feel free to contact us in the chat or through other means if you would like to have more information on this. And I wish you all a nice continuation of this Planet Red Summit, hoping you will also hear more inspiring sessions. There will be more sessions on disaster preparedness as well in the coming days. So once again, thank you so much, everyone, and have a great day or evening or night, wherever you are.